Hello, how are you doing? My name is Eunice Houlihan. I'm a family physician working at HealthWest Medical Practice at Millbrook, and we're going to talk today about migraines. Migraine is a neurological condition, chronic, that presents with migraines attacks. Migraines is caused by change in the brain chemicals in the brain and the relationship of the brain with the trigeminal nerve. The migraines attacks is a type of headaches. These headaches usually present unilateral on one side of the head. They come like a throbbing or pulsatil characteristic of a headache and may last between 4 hours and 72 hours. These headaches can be associated with nausea, vomiting, dizziness, and sometimes a discomfort with the light and sound. The headaches usually resolve with medication or if the patients go to sleep. In some cases, migraine can be preceded by other symptoms and they're called aura. Those symptoms could be flashes of lights, sounds, dizziness, tingling in one side of the head or one side of the face. Migraine runs in families, so usually we have some parents, uncles, siblings with migraines, and it's more common in women. The symptom can start at any time, but occurs mostly around their 20s, peak in their 30s, and it gets better with age. The migraines, they say, or is described that is present with four characteristics or four stages. Not everybody presents all the stages of migraines. The first stage is the one called prodrome. The prodrome can be days before the migraines, and people may feel fatigued, constipated, feeling tired, yawning, and sometimes increased thirst and increased urination. Then it comes what is called the aura. Not everybody presents the aura, but the aura is the symptoms that I described before. So people see like a flash of lights. Some people feel like numbness or tingling on one side of the head or one side of the body, yawning, weakness, and sometimes some jerky movements before they have the headache. The headache percent of the attack is when the person presents with the headache, and as I said, the headache most of the time is on one side, is throbbing, maybe moderate to severe, and may last up to 3 days. It does not treat it. And with the headache, people may have dizziness, nausea, the lights may bother them, the sound may bother them, and usually they go to sleep, the headache goes away. And the postdrome is after the headache. Some people may feel very tired, fatigued, and dizzy after they have the migraines. Sometimes can feel moody or weak until 2-3 days after the headache. Other headaches that may mimic migraines are tension headaches, that we call this stress headaches or occipital headaches in the back part of the head, cluster headaches, headaches for Chiari malformation, headaches that can be caused by tumors, infections, autoimmune disorders, and something called thunderclap headaches, that are headaches that develop very sudden, very quick within 16 seconds, and they are very severe, and that could indicate a problem in the vascular system in the brain. So one of the best ways to prevent headaches is to create a migraine diary. The migraine diary gives the patient the power to document how often they have the headaches, if they notice anything before the headache, any aura symptoms or prodrome symptoms, how long the headache lasts, if the headache change in nature, sometimes it's dull, sometimes it's pressure, sometimes it's throbbing, if there was any medication that helps, and also if there was any alternative treatment that they did that helped. There is different things that can be trigger migraines, and avoiding the triggers is very important to prevent that the attacks come so frequently, to prevent the frequency of the attacks. So one of them that is difficult to change is the hormonal changes. So hormonal changes, women sometimes before they're having their period or in the first days of the period, they can have migraine headaches. Migraine headaches also happen more often when the women are pregnant and decrease in frequency when the women go through menopause. Contraceptive, birth control, especially oral pills and the patch can increase the headaches or make them worse. Another things are things that we eat, food, alcohol intake, wine, highly caffeine drinks, aged cheese, salty or processed food, sweeteners, especially the aspartame, that's the one that is called Nutrataste, the blue one, and skipping meals. So it's ideally that you eat your 3 meals, but prevent all of these above items to see if they are triggering your headaches. Stress and anxiety also can increase the headaches. Sleeping disturbance, the people who sleep too much or sleep too little, or when the people have jet lag, when they travel from one place to another, that can trigger a migraine. Sensory stimuli like light brights, like the neon lights or the lights on the computer, loud sounds, strong smells, strong chemicals, strong perfumes can trigger migraines, and also smoking and even secondhand smoking. Physical activity like strenuous exercise or sex can trigger a migraine. Dehydration and changes in the environment, like the barometric pressure, so people know when the environment is going to change because they start having a headache. And some other medications also can increase the risk of migraines. Some of them are vasodilators and contraceptives. There are different procedures that can be done to prevent headaches, and it's part of treatment, part of prevention. Some of them are Botox, acupuncture, some transcutaneous stimulators, and transcutaneous supraorbital stimulators. By then, there are people who really are very disabled because of the headaches. And something else that you can do to help with your migraines is relaxation exercise, sleep, try to sleep the same hours at night, meditation, yoga, and massage therapy. So treatment, as I said before, it's good to have the migraine diary and explain to your provider the headaches that you have and see which one of them are migraines, and start discussing the avoidance of triggers. Migraines can be mild or can be very severe, so your provider is going to determine how many of them are severe. If you have at least 4 severe headaches a month, you need to start medication to prevent migraines. Severe, I mean headaches that you cannot get out of bed, that you are confined, or you cannot go to work, or you cannot go to school. They are really debilitating. There are some severe headaches that people can take medication and they are not that bad. They can still do their activities. So if you have more than 6, you may need medication. If you have 1 or 2 migraines a month, most likely it's better to take a medication just to treat the migraines. So to treat the migraines, we can use pain relievers, and one of the ones that is most successful over the counter is the Excedrin migraine. But some people use the Tylenol, ibuprofen. There is other pills that are prescribed by your provider called triptans that can relieve the headaches, and it comes in pills, it comes in injections and nasal spray. And the other ones are called ergotamines. This is another kind of medication that call in a nasal spray and injection. The nasal spray and injections are important because a lot of people, when they have the migraines, if they have nausea and dizziness, they're not going to be able to tolerate any oral medication. And for prevention, as I say, your headaches are that severe that you need a medication to prevent the headaches. Those are medications that you have to take every day, and usually at least for 6 months, and then your provider can decide if you want to take it for longer, depending how you're doing with your migraines. So some of them are cardiovascular drugs. The most common ones are the called beta blockers. The most common ones is propranolol, metoprolol, timolol. They are taken every day. They prevent headaches. There is also the calcium channel blockers called verapamil, and another one called lisinopril. Anti-seizure medications can decrease the headaches. The only problem with anti-seizure medications, some of them need frequent blood work and can cause sedation. The most common ones is valproate and topiramate or Topamax. Antidepressants also, and different ones. There is the tricyclic antidepressants like a nortriptyline or amitriptyline, or serotonin and norepinephrine reuptake inhibitors like venlafaxine. Those medications can help with prevention of headaches, and they're good for people who have anxiety or they are under a lot of stress and they have the headaches. And there is a new medication that has been in the market that is an injection. It's called the calcitonin gene-related protein agonist, or amiobic. And that's once a month. It promises to be very effective in decreasing headaches, but we have to try first with the oral medication before we go to that one. The psychotherapy and biofeedback, cognitive therapy also help with headaches, especially if they're triggered by anxiety and stress. And for resources, one of the ones that I always give to my patient is the Migraine Monitor app, because it's an app that they can start logging in how often they have the migraines and what triggers it, if there was anything that helps. There is another one called speakyourmigraine.com. There is the Migraine Screen Questionnaire. The National Headache Foundation and American Migraine Foundation have a lot of information about prevention, treatment, and research on migraines. Well, thank you for your attention. If you have any questions, feel free to contact us at ABClatino or HealthQuest Medical Practice.